The rates that I have for you from the tropion studies, from these pooled studies, is about 7% ILD. So not super high, but still something we need to be watching for, still something we need to be vigilant about. Thankfully, grade 3 or higher, pretty low, almost like less than 1% if I remember correctly. So I feel better about that, but it's definitely on my radar. And even for grade 1 pneumonitis with an ADC, with a drug like Dato-DXd, I'm even pausing the drug. I'm thinking about what to do for my patients, and I'm watching them very closely.
Amazing. So, and let's put it in perspective here, because now I'm going to tell you the numbers I have in breast.
Okay.
But when you give a drug like trastuzumab deruxtecan, what is the ILD rate that you see in lung cancer?
Yeah, so it can be higher. So it really depends on our dosing. And I'm trying to remember what the breast cancer dosing is for you guys, but we use a lower dose because we saw higher rates of ILD pneumonitis, right? Okay. So it was upwards of 15%, if I remember correctly, if you used the higher dose, dropped significantly if you used the lower dose. And so I would say it's roughly about the same in terms of ILD, maybe even a little bit less.
So you guys
with
use
trastuzumab
4.4?
deruxtecan. So we use 5.4.
5.4.
What do you guys
use? We
use?
use 5.4.
Okay, yeah.
Yeah, for the same reason, because the earlier studies showed that the higher dose caused ILD. So for us with the Dato-DXd, we see half of what you guys see.
Wow.
So it's almost about 3.5%
okay.
ILD risk. And you're right, we don't see much of those grade 3 or higher. They're maybe less than 1% in those patients. But definitely it's much lower than what you see with the trastuzumab deruxtecan. Over here, across every single study, you see somewhere between 10 to 12%.
Yeah.
So it's like a third of that we see with the Dato-DXd, and half of what you guys see in lung, which is really reassuring. Now, you're right. The way we see it, and for us, that was the first drug that caused ILD, to be honest. Not Dato-DXd, but T-DXd was the first one. So for us, it was a learning curve. I assume with you guys, you've been dealing with this for a while. How is it different when you look at ADCs-induced ILD versus immunotherapy-induced ILD or TKI-induced ILD?
Yeah, I mean, I think first, you can see the ILD happen sooner on ADCs than you do with immune checkpoint blockade. So I think being more vigilant even at the beginning is more important. Second, it can take longer to manage, I feel, to be honest with you. And you want to catch it quicker. Otherwise, the domino effect happens a lot sooner than it does with immune checkpoint blockade. Third, usually if I have a patient with immune checkpoint blockade and they have pneumonitis or there's concern, it's grade 1, restricted just to the imaging, the patient's otherwise doing well, we usually push on. We feel okay, we feel comfortable. I don't feel that way with ADCs. We hold the drug, we don't do it. Grade 2 is a hard stop. If you get grade 2 pneumonitis with an ADC, we don't rechallenge.
Yeah.
And I think grade 2, actually there's the spectrum of grade 2, and I'm
100%.
sure you can appreciate that, right?
100%.
And so I'm always asking our expert interventional pulmonologists and our pulmonologists at our institution, hey, help me with this patient. Where on the grade 2 spectrum are they for immune checkpoint blockade? Could I one day rechallenge them? Yeah. I'm a lot more nervous to do that with an ADC.
Yeah, and there was, for us in breast, there was a provocative paper by Dr. Hope Rugo. Because grade 2, you're right. If you follow, because there's black box warning on those drugs with the ILD. And it's a hard stop if you get grade 2. So any grade 2, what we mean is any symptomatic ILD that's considered a grade 2. Grade 1 is when you catch it on a scan when it's asymptomatic. But for us, if you follow the guidelines, they say any grade 2 or above, you stop. However, there was this provocative paper by Dr. Hope Rugo that looked at those grade 2s. And you're right, grade 2s do not all come in single flavor. So those grade 2s of patient that they held the drug, treated with steroids, patient did better right away and went back to essentially a grade 0. Those patients were rechallenged, although the guidelines say do not rechallenge.
Yeah.
But on that small observational study, they rechallenged and they did fantastically well.
See, I love studies like this. This is what we need. We need to encourage to have these studies, right? Because in the real world, we're going to run into these circumstances and we need to know what to do and 100%. We need to have some comfort. So I love that.
100%.